The conversation around mental health continues in the wake of the death of Daniel Prude. Monroe County Executive Adam Bello is calling for change.
And mental health professionals at Rochester Regional Health are shedding some light on what the process looks like now and how we may move forward to make change. Kayla Green talked to both of them today and reports.
Monroe County Executive Adam Bello says the county spends $40 million on the mental health department and says it clearly isn't working. He says for things to be fixed, the entire system needs to change.
And how are we making sure that the systems are working for people to help people?
Adam Bello says he's talked to the Race Commission about speeding up the process to make changes in mental health and law enforcement systems.
If you call 911 for almost any other reason, you get a police officer. That doesn't help anybody. That doesn't necessarily always help the person who's calling 911 and needs help. And what we really need to do is figure out how do you change that whole system so that the reason you're calling 911 for help arrives and it's the right type of help.
Mary Morocco is the medical director for emergency and consultative psychiatry at Rochester Regional Health. She says in an emergency mental health call, a person can be brought to the emergency room if they present a danger to themselves or others. Once they're brought in, mental health professionals evaluate them for several hours to determine whether they should be admitted.
We do not want to be taking people's freedom away from them if there isn't a compelling reason to do so. So we are able to hold someone as long as necessary to ensure that there is not an imminent risk of harm to self or others. But that said, once there is no longer that harm, we really can't legally hold that person beyond that.
Morocco says she believes the solution isn't one entity or the other.
It isn't either the answer is only mental health professionals or only law enforcement, but we need a hybrid of the two that provides for safety as well as the most clinically appropriate intervention.
Rochester Regional Health also has a behavioral access and crisis center. The mental health professionals who work there go out into the community routinely and assess people based on family calls. In Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Morocco says Rochester Regional is contacted by the Monroe County FIT team frequently to give them a heads up when someone might be coming in.